The current care system is broken. Decades of cuts have resulted in local authorities spending less on social care for older and vulnerable people. Businesses have stepped in to fill the void, with many care homes and home care providers being run by private companies. When profit comes into the equation, we have a compromised situation. As long as we keep looking to business or government to care for our vulnerable, we are lost. We believe there's a better way.
So many health and social care workers say the system is in crisis. More staff than ever are overwhelmed and leaving. Recruiting staff into care in particular is a challenge, with the majority of roles paying minimum wage for a highly complex yet undervalued job. These workforce shortages have resulted in many providers of care at home being unable to fulfill contracts with local authorities. As staffing issues have escalated, margins have been squeezed and the provision of care compromised. From meeting basic hygiene needs to tight budgets for meals and lack of time for human connection or a chat. Staff are stretched, badly paid, with agency workers often drafted in with no relationship with residents. It's estimated that around 500,000 people may be waiting either for an adult social care assessment, a direct payment to begin, or review of their care. Did we collectively stop caring? Did we simply become too busy to look to our neighbours and those in our communities who need support? Has inadequate care become the cultural norm?
This affects everyone. There is a ripple effect down the chain when we don't have adequate support for older or vulnerable people. There are record-breaking waits in emergency departments, as well as dangerous and often fatal ambulance handover delays. The system is gridlocked. And if we continue to accept private equity firms running the big care providers and making margin enough to take profits to offshore tax havens, we are allowing profit to be placed over people. And this is never going to end well. Old age is a privilege, and if we're lucky, it'll come to us all. You or someone you love may be the one who needs help with day-to-day tasks like eating, drinking, and dressing. And let's not forget, complex needs and special needs can arise at any point of life and in any family. So we all have a vested interest in creating a new system that works for the vulnerable, their families, and the carers. We can no longer live in isolation, thinking somebody else is taking care of this.
We need change. This is everyone's problem, and we can all be part of the solution. For us, this is about building community and compassion. We're working on new models for care, such as social enterprise care homes, care cooperatives, and ways to help people stay at home longer. We're envisaging people coming together to reinstate our elders as the keepers of wisdom and traditions that they are, and to appreciate the vulnerable for the joy and the beauty that they bring. Our elders and vulnerable citizens have important roles to reinforce social values and to maintain a sense of social justice. It's important that they have not only their physical needs met. Mental well-being is a huge issue for many who are made to feel a burden lonely, isolated, unloved, and untouched. So much joy comes from contact with nature, animals, children, and music, and these things should be an integral part of any care plan.
In September 2022, the People's Health Alliance and the People's Care Watchdog came together and created the People's Care Alliance, quickly pulling together a team of like-minded people who are already making real changes in their communities. The aims of the People's Health Alliance were clear: to empower people to take responsibility for their own health through a network of community health hubs. These hubs will eventually provide a mix of medical and alternative practitioners, from district nursing to acupuncture, from GP services to osteopathy. This grassroots initiative has evolved organically since launching in April 2022. Aimed at addressing all areas of community life: health, education, social care, commerce and food. We don't have all the answers, but through our collaboration with other grassroots organisations, we are confident that together we can create a new world for our children. One driven by community and compassion, where everyone has a part to play and everyone is valued equally.
The People's Care Watchdog was created by families who came together to support each other in navigating the care system during lockdown. We grew into a campaign to stop neglect and abuse and to seek to empower families in understanding their rights and options. Together, we are working through 2 stages to shift attitudes and open up opportunities for those who need care, their families, and care workers. The aim is to create new systems of care that place profit behind people, bringing dignity, decision-making, and control back to individuals and families, and reinstating the profession of caring as one of the most important in our society.
The first stage is the creation of resource packs. We have been gathering first-hand experience and advice from families about what they wished they'd known before they started navigating the care system. Our hope is that this information will empower and support families in understanding their options in 3 areas. Practically, how to care for your loved one in your own home or in a care home. Legally, what do you need to know in terms of your legal rights and those of your loved one? And financially, how to cover costs and access financial support. These packs aim to empower families to ensure that their wishes and needs are met, which is especially important if somebody loses the capacity to make decisions for themselves.
The second stage is focused on creating the new. Firstly, we're exploring how can we help people stay at home for longer? Through a network of community hubs, can we assist people in accessing equipment, home adaptations, support, or could care cooperatives be set up? Secondly, we're developing blueprints for new models of living and caring, such as social enterprise care homes, small low-impact builds, and repurposing retirement apartments. One of the heartbreaking things about dementia is that often couples are separated after a lifetime of living together. So one of our ideas is to work with housing associations and retirement apartments to rethink their usage. What if young professionals starting out in their lives could pay minimal rent in exchange for helping older residents in their same block? Finally, we want to re-evaluate care work in terms of the training, support, and pay. We believe caring is a vocation, and we must truly support those who have this calling.
Today, the People's Alliance boasts health hubs across 30 counties in the UK and Ireland at various stages of development, with half of those actively supporting their community in some form. But that's not all. This initiative has inspired many people around the world, with hubs forming across New Zealand, Australia, North America, Portugal, Spain, and many more countries excited to get going. Through sheer hard work and determination, these incredible achievements have been reached with barely any budget and no support from government and conglomerates. This was, and always will be, about people power.
So how can you get involved? Well, there are lots of ways. Subscribe to PHA and find your local community hub. And if there isn't one yet, we can help you with a blueprint and ideas of how to set one up. If the hub near you isn't offering what you think your community needs, get involved. All ideas are welcome. Carers and NHS staff forced to leave their profession due to mandates, please get in touch. We have a place for you. But you don't have to work in care or health to get involved. We are looking for people to help in a number of areas, such as fundraising, social media, finance, legal, admin. We all have a part to play and skills to bring to the table. If not now, when? We believe now is the time for us to come together to build a beautiful future for care and health.
Together we can make this happen.